This is Dr. Drew Hall with Sarasota Upper Cervical Chiropractic. Today what we're going to talk about is post-concussion syndrome. Being an upper cervical specialist, which means we focus on the upper neck area, the C1 and C2, right where the brainstem comes out of the floor of the skull, we see quite a large number of post-concussion cases over the years. So most people, when they think of post-concussion syndrome, they're thinking headaches, cognitive problems, depression, anxiety a lot of the time, vertigo, and of course neck pain, pressure at the base of the skull. And we've been told that these problems are coming from a head injury that sheared the brain tissue, and of course that affects the neurology of the brain, blood flow, and so forth. But it doesn't explain a lot of the post-concussion cases that come into upper cervical chiropractic offices that have been suffering for 3 to 5 to 7 years. And that's why it's called post-concussion syndrome, because a lot of these cases just doesn't seem to go away. And so we talk about what we call the missing link. Everyone knows a concussion, you have the shearing of the brain, and any injury that was forceful enough to actually rattle your brain against your head and shear the brain tissue simultaneously is affecting the structure of the upper cervical spine. And most of us who do upper cervical work feel that post-concussion syndrome, the people are left with this long-term, chronic, debilitating symptoms that just don't seem to go away, are not part of the brain injury, but they're part of a structural problem that happens at the base of the skull. So just to talk a little bit about the engineering of the neck and head. Average person's head weighs 10 to 12 pounds, which is basically like a bowling ball. And the vertebra that sits on the atlas, right here, weighs 2 ounces. So you have a 10 to 12 pound bowling ball sitting on a 2-ounce bone, sitting on the end of a stick. And just the nature of having a big mass perched out on the edge or the end of a stick, your neck, when you have an acceleration type injury, again, that rattles the brain across the head, you simultaneously have a structural injury to the upper cervical spine. Now, every joint in the body, it's not just the neck, every joint in the body where 2 bones actually come together, there's a very fibrous ligament. It's called a joint capsule, and it gives integrity to that joint. In other words, if you didn't have a joint capsule at the end, last joint in the finger, you could take the finger and just bend it to the left or right, and it would move rather easily. The reason it doesn't, and most joints don't, is they have that really strong fibrous capsular ligament that's housing the joint. So when someone has an acceleration injury, that joint misaligns out of its normal range of motion. It tears the capsular ligament, the soft tissue surrounding it, and then as a protective mechanism, what the body does, the deep layer of muscles actually go into what we call splinting. They go into contraction. It's a reaction to the injury, and it's also a protective mechanism, because now we have this joint that's kind of hypermobile and the muscles are taking over the job of what the soft tissue will do. But what that does is when you have that spinal misalignment, it heals out of position in its improper position. What it does is it irritates this red area right here that's called the brainstem, and the brainstem is the seat of control for what they call all the autonomic function in your body. And autonomic just means basically automatic, right? I'm here sitting right or talking to you right now. I'm breathing, my heart's beating, my blood pressure is being regulated. I have certain muscles that are contracted, keeping me upright against gravity so I don't fall over. I'm not consciously thinking about any of that because it's all happening here at the brainstem. And so these people who are suffering with post-concussion syndrome, they've suffered this injury. They have one or two or several segments in the upper neck that have misaligned. They're locked out of position. It's irritating the central nervous system and the brainstem, which controls the whole body. And this leads to all these chronic problems that the person has. So people who come into upper cervical chiropractic offices, whether it be post-concussion syndrome or any other condition, they're run through a battery of tests to determine whether they have an upper neck misalignment. And if they do, where is it? Is it C1? Is it C1 and 2? Is it 1 and 3? It can be any number of combinations. And then once they've shown a positive indicator that there's something going on, we take 3D imaging of the upper neck to look at each individual joint in the neck to see how it's angulated. Everybody's built differently. How it's misaligned, direction. And once we have that information, we can then deliver a very precise force into the joint to set it back in its normal motion. Now, once that's done, it's not like the body just miraculously heals out of it in a day or two. The body's got to go through a healing process. The patient needs to be monitored over time. And so the whole goal of the upper cervical procedure is to find out where they have the misalignment, correct it, and then monitor it over time so the integrity of the tissue surrounding the joint can heal back up and you have normal motion and normal neurological function. And as a consequence, what we find with most of these post-concussion cases, they go through this episodic up and down recovery process over a period of time, and the grand majority of them either have significant relief or resolution, which was my case 30 years ago. So for those of you who have maybe come across this on YouTube or my website, you're suffering with some of these problems, we have an office on the west coast of Florida, Sarasota. We serve Bradenton, Tampa Bay, Venice, Osprey. Those areas are within striking distance of our office. If you're outside of the Florida area, just Google upper cervical chiropractor and do yourself a favor, get into an upper cervical office, get your upper neck checked out. And if you have a problem, get it cleared out so your own wisdom inside your body can go through a healing process and you can quit suffering and living a half-lived life like I was 29 years ago. So thanks for listening. We'll see you guys next time.